Welcome to our continuing conversation about the flaws of big social media platforms in response to the disinformation campaigns around the COVID-19 pandemic, a very, very serious situation, obviously, where lives are literally in the balance. I'm Frank Sesno, director of the George Washington University's School of Media and Public Affairs, affiliated with the Institute on Data, Democracy, and Politics, which is presenting this event together with the International Grand Committee on Disinformation. I'll be your moderator and your timekeeper, and I will continue this conversation with our distinguished panelists and guests. If you are a journalist joining us, please feel free to put your question into the Q&A field. Make sure that is addressed to everybody so we can all see that, and I will try to incorporate at least some of those questions to our panel in a bit. Social media platforms, as we know and as I've discussed, are allowing unscrupulous actors to sell unsafe, illegal, and overpriced medical equipment during this pandemic. And that's one of many issues that we see across the social media platforms. But this one is not a new problem. Social media platforms, however, continue to allow these dangerous disinformation during the COVID-19 pandemic. And in so doing, they expose just how dangerous and how irresponsible this kind of behavior can be and the role they play in continuing to allow it. Rampant conspiracy theories make the situation worse, confusing people, distracting people. Social media platforms have the technological know-how and the resources to fix it, but they actually have little incentive to do so. Now, we've got a distinguished panel to discuss these problems, people on the front lines who are dealing with these issues directly, and legislators who are trying to do something about it from two countries. First, though, a look at some of the issues and the stakes to launch this conversation.
Masks advertised on Facebook by fake companies, touting the mask can filter out 99% of harmful particles. Here's what you pay for, and here's what you get.
This is a counterfeit product scam.
I'm a foster father for boys out of Williamson County Juvenile Justice who otherwise have no place to live. We knew we needed masks because we are responsible for overseeing these children, the health of these children, the welfare of these children.
New warning from the FBI about coronavirus scams.
I had noticed an ad for a mask on Facebook. I certainly saw Facebook as a legitimate company. So I had ordered my mask on April 3rd, and I got the confirmation that they received my payment.
Mask scams are on the rise with the increasing need for these protective supplies.
After my initial auto reply from Facebook, it's been silent. I've gotten nothing from them. I absolutely have thought about the fact that without these masks coming, that it put these children and their families and our organization at higher risk.
So my apologies for the reversion to video there and some of the technological glitches we have in trying to connect the world via WebEx, but we're learning. This is a learning process for all of us, so your indulgence is very appreciated. Again, apologies. Let me try this again. We have two leading U.S. lawmakers who are charged with consumer protection in the United States Congress, another from Canada, who's also a leader in the International Grand Committee on Disinformation. Senator Richard Blumenthal joins us. His advocacy for consumer rights traces back his 2 decades as Connecticut's Attorney General. And let me just say, Senator Blumenthal, coming from Connecticut, great nutmeg state and all the rest, it's a great pleasure. Advocacy for consumer rights, more than 2 decades as the state's Attorney General, and then his work in the Senate on the Commerce and Judiciary Committee. Recognized leader in the Senate, in the Democratic caucus on this issue. Congresswoman Jen Szarkowski from the great state of Illinois, 9th Congressional District. She chairs the Consumer Protection Subcommittee of the House Energy and Commerce Committee. You serve as the Senior Deputy Whip in the House leadership as well. So thanks to you for joining us. We're also joined by Nathaniel Erskine Smith. He's a Canadian member of Parliament from the Liberal Party, former commercial litigator, now sits on the Standing Committee on Industry, Science, and Technology. He's been demanding action on disinformation for quite some time. I'm going to ask our lawmakers if you'll bear with me and allow me the timekeeper role here as I turn to our witnesses, people who are experiencing this disinformation firsthand. Randy Smith is a mentor to at-risk youth in Round Rock, Texas, after a successful corporate career. Randy followed his calling to become a house parent, as you saw in that video, at the Reset Mentoring Foster Home in Round Rock. He's the kind of community leader, as we see in that video, that we all like to have. And Randy, thank you, and we celebrate you, and we appreciate everything that you're doing. Dr. Sonia Stokes is an assistant professor at the Mount Sinai Icahn School of Medicine and a fellow at Johns Hopkins Center for Health Security in the Division of Biosecurity. She's a clinical attending physician in the emergency department treating patients at Mount Sinai Morningside Hospital, also serving on the Mount Sinai COVID-19 Best Practices Committee. Let's get a sense of what's going on with you out there in the world, and then bring that to our elected representatives for further conversation. So, Randy Smith, let's start with you. Go ahead and share your story. Obviously, we saw you in the video saying, expressing your experiences and your frustration and the stakes of what this is all about. But go ahead, the floor is yours for a couple minutes.
Thank you, Frank. When this pandemic happened, we became concerned about our ability to serve and support the teens that were in our program. We immediately started looking at the need of the teens, but as well the logistics of complying with the social distancing guidelines. We knew we would need to perform wellness checks, tutoring, rides to work. But what we quickly realized is we were also going to be responsible for supplying food and other supplies to many of the families. Initially, when I found the masks, I found some on Amazon, but they were only the dust masks. The local stores were out, so I followed a link to masks that were advertised on Facebook. Knowing that Facebook is a legitimate company, I assumed that they only allowed legitimate advertisers. So I went ahead, purchased the masks from Zest Ads through Facebook. Shortly later, I received an inaccurate order confirmation from Zest Ads, which let me know that something was wrong. In looking into that, I found a Facebook group with over 1,000 members, most of whom had ordered from Zest Ads. And by this time, hundreds had posted information regarding the dispute on Facebook and PayPal, but it was very difficult to find anyone posting resolutions to those concerns. It wasn't just face masks. Hundreds had ordered these robotic vacuums, drones, and had become victims of the scam. So it was apparent that Facebook had been aware of this for several weeks. There were no secrets that people were getting ripped off. I'd imagine that for every one person that reported, there might have been hundreds that didn't speak up or say anything. And I look at it, if I walk into Home Depot store and select a product, they have a responsibility to make sure that I receive what I was sold. And they're also regulated to protect my electronic funds. The platform of selling online needs to be held to a higher standard. The fact is, they're often representing a company that does not have a storefront. There's a seller that may not be based out or may be based outside of the United States. And so consumers are powerless in confronting them. We can't walk in and speak to the returns counter. So it's easier to get ripped off. And I think allowing this fraudulent practice to continue will only cause consumers to be more cautious about buying online. And that's going to be at the expense of smaller, reputable companies that rely on that platform to promote and sell their products. So in the grand scheme of things, $200 may not seem like a lot of money, but regardless of the amount, it is theft of another person's precious dollars. And for someone like me or our nonprofit organization who serves and houses these at-risk youth, on essential donated dollars, every dollar is absolutely vital.
Well, Randy Smith, let me say a couple of things. First of all, you say $200 isn't very much. One person, multiply that times 100, 1,000, a million. You're talking serious dollars, and you're talking major, major fraud cast over a lot of people. I also want to say, and I think this is very important, that your story is known and got told partly because of the incredible work that Craig Silverman from BuzzFeed did, along with our Institute of Data, Democracy, and Politics and our colleague Trevor Davis, as they started looking into some of these this proliferation of social media and emails. There were a billion emails wrapped around this, that some of these things that they found your story. And I think part of what is so important is exposing these things. And so thank you for sharing your story with them so that it could be reported. And thank you for sharing your story with us right now.
Thank you.
Yeah, well, we'll come back to you. Dr. Stokes, I want to turn it over to you for your perspective on this.
Thank you. As an emergency physician in New York City, I've managed more than 100 cases of COVID-19, but I've lost count of how many people were exposed not to the virus itself, but to medical misinformation about the virus on social media. And it's hurting my patients. One of my first cases at the beginning of March was an elderly woman brought in by her adult son. She had fever, cough, fatigue. Her heart rate was high and her oxygen was very low. And when I told her son the news, he didn't believe me. He didn't believe the virus even existed. He actually showed me his Facebook, and there was a post that said something like, COVID-19 is a hoax made up by drug companies to sell vaccines. That same week, another patient was brought in by her daughter. Same symptoms, same diagnosis. But her daughter insisted to me that there was no way her mother could have the virus because she read on Facebook that COVID-19 was prevented by antibiotics and vitamins. So she went to the bodega in her neighborhood and picked up these pills for her mother, who had been taking them every day. So there was no way her mother could have COVID-19. I've had so many of these conversations since the beginning of the outbreak. And after everything we've been through in New York over these past 3 months, I am still having these conversations, most recently on my shift just last week. When I counsel patients and their families about the facts of COVID-19, they are understandably confused and scared because they've already been exposed to so much conflicting information. They don't know what's real and what isn't. And a common reaction is for family members to get angry and ask me, how is it even possible for the patient to have COVID-19? They'll say things like, my mother has never left the house. She's not been in contact with anyone except for us and the grandkids, and we're all healthy. At first, they don't make the connection that even though they themselves are young and healthy and have no symptoms, they can still have the virus and they can still pass it on. And eventually, after we talk, it starts to sink in. And one of the things I'll never forget is that look on someone's face when all of a sudden they realize they are the one. They're the one who likely had the virus, and they likely passed it on to their loved one who is now dying. I've seen that look so many times, and it's something I'm going to remember for the rest of my life. I have been told that the way to counter medical misinformation is to put out just as much accurate information. But social media is so fast, I can't keep up. And in the middle of a pandemic, there's just not enough time. We're fighting just to keep our patients alive on the front lines. We should not be fighting this war on information at the same time. It's just not possible. We are trained to handle mass casualty events. We are not trained for this, and we need help. Thank you for listening.
Wow. Dr. Stokes, thank you very much. And not only are you not trained for this, you should not have to spend you should be spending your time treating patients, not treating disinformation. But I want to ask you one question before going to Senator Blumenthal. These stories that you tell are really disturbing and very shocking, of patients who think that they can get a pill or take a pill and they'll be immune from it down at the corner bodega or whatever. And these other examples that you give. Are these, and this is not scientific, this is just anecdotal through your experience that I'm asking, recognizing that. Are these rare cases, Dr. Stokes, or are these coming from 10%, 20%, half of the people I mean, give us a sense just from your lived experience, how prevalent is this misinformation, disinformation in what you hear from patients?
I would say with great confidence the overwhelming majority. Just to give you a sense of this, at the beginning of the outbreak, some of the people who were actually looking at some of this information and questioning it were actual doctors. One of the things I do at Mount Sinai is look at the literature and make sure that we're following best practices. I don't think you don't understand what it was like in the beginning, the end of February and the beginning of March. We just didn't have enough information. And so I hate to say it, but I had colleagues of mine that could fall for some of these hoaxes that you would read on Facebook. And I think now it's much more clear. But I think if we're having people from the medical community who weren't able to necessarily identify false information from good information, what can we expect from patients? I don't know how it's possible to put the onus on people to know how to sift through that information and make decisions for their health that are based on actual good information.
Thanks, Dr. Stokes. Senator Blumenthal, let me turn to you. You have taken on the health insurance industry. You've taken on big tobacco. You have been an outspoken advocate for consumer rights. In this case, consumers, as we just heard from Dr. Stokes, are getting huge amounts of bad information across the social media platforms. The scammers who are selling stupid, useless pills like this, leading people to think that now they're immune. The conspiracy theories that kind of drive people in all these different directions. Let me just turn it over to you, and you can respond to what you heard from Randy Smith and Dr. Stokes, and give us a sense of what should be done about it. What should the platforms be doing about this? You're muted, Senator Blumenthal. Sorry, we can't hear you. Can you unmute yourself, or we'll unmute you? Still muted. There we go.
Okay.
And welcome. Thank you for joining us.
So let me just repeat my thanks even more enthusiastically to you and GW, to Randy Smith, to Dr. Stokes, who have described so compellingly some of the real harms that result from this disinformation. And to my colleague, Jan Szarkowski, thank you for being such a steadfast, energetic warrior on behalf of consumers. And I'll tell you my reaction as I listen to these stories from the real world, and I encounter them every day. I am so angry and really just outraged. I know we use that word a lot, but when you hear not only the threat to pocketbooks, Randy Smith says it's only $200, $200 here, $200 there, and pretty soon you're talking about real money. And I've been involved in class actions involving a lot less than $200 losses per person. But what Dr. Stokes says so compellingly is that there is a real threat to human life and safety. And so big tech, which can be a great boon, also can be the bane of our lives, a real threat when they convey disinformation, and too oftenly they are complicit. I use that word very deliberately. They are complicit, in effect, aiding and abetting the spread of deceptive and misleading ads that do grave harm to people or threaten that harm. And I'm going to give you one or two examples that are particularly out of bounds, cross the line, where big tech has an obligation to do better. Congresswoman Szarkowski and I are writing a letter today. We're releasing it. She's been a real leader in this effort, that say to the FTC that it should be taking action against the frauds and scams around the stimulus payments that are being issued by the federal government. All too often, people who are eligible for these stimulus payments are not receiving them due to United States Treasury's laggard and lacking efforts. And now what we're discovering is that people who go to Google encounter malware and fraudulent schemes and referrals. that Google does or should know are scams. And we're asking the FTC to take action, not only against the advertisers or the con artists, but also against Google, because it has taken action in the past against advertisers or web designers that engage in enabling frauds to reach ordinary people. We're asking the FTC to take action. You mentioned exposing these frauds. Well, exposing them is very, very important, but enforcing against them is an obligation of the Federal Trade Commission and often the Federal Communications Commission. All of these alphabet soup agencies have a real responsibility that affects people's lives. You mentioned fake cures. Absolutely astonishing. By the way, the project that we're doing today, the letter, is the result of the Tech Transparency Project. But likewise, on fake cures, the Center for Science and the Public Interest has released a list of 46 separate false cures. They're dietary supplements, they're chemicals. There's no vaccine, as you know, for COVID-19, and there are no proven therapeutics or treatments, and certainly none of these are. And so I have written to the FTC asking them to take action.
And just to be clear, these 46 fake cures are being promoted and represented as cures, and the platforms are you saying nothing to pull them down, to identify them, to expose that?
They did nothing on their own until we wrote to the FTC. Now they're down, but they're more in their place. So to go to your key point here, the platforms are failing to act against them on their own until they are ordered to do so by the FTC. And of course, the FTC is limited in terms of its resources, but also in the past, often it's lacked the will to do effective enforcement. So we are also, on the subject of masks, going to be going to some of the largest online marketplaces, Amazon, Craigslist, eBay, Alibaba, to ask them to stop selling masks that in fact are not only ineffective, but potentially dangerous to people. And Dr. Stokes probably encounters a lot of people who say, well, I was wearing my mask all the time, and it was supposed to be an N95 mask, and in fact, they may be infected because of the misleading and deceptive pitches. So you can go through price fixing, profiteering, price gouging, also the deceptive and misleading ads and pitches, all of them directly or indirectly the result of these platform complicity in the false and fake scams.
Congresswoman Szarkowski, let me turn to you for a couple minutes. And you co-authored this letter with Senator, as he was just talking about it. Would you talk about that? What exactly are you two calling to be done? And again, I'd like to ask you to be, as we are here now, we're focusing on scams, fraud. I mean, ripping people off in the name of COVID-19 safety or health or cures or whatever it is. So tell us a little bit more about this letter and where this needs to go. Congresswoman, you're muted as well. Sorry. There we go.
There we go. Sorry. There are a number of tools that we can use, and one is going to the Federal Trade Commission, which really does have the authority not only to force that the fraudulent ads be taken down, but there are also penalties that the Federal Trade Commission could use. And we are calling on at this point, we're calling on Google to take responsibility. This issue of the immunity that these platforms feel is a really dangerous situation. I along with Senator Blumenthal, we've also written to Facebook because they are allowing the sale of these incline sleepers that have killed 100 children already, and that the Consumer Product Safety Commission says should not be sold. But they are selling them on their shop that Google has. So we are seeing this, and I also want to thank the Tech Transparency Project. They showed, people are looking for information, and so they go to the internet, and if they just look up these who's selling the fraudulent items, including the masks. I mean, Randy tells a terrible story. It is because while there may be some that are legitimate, the consumer has no way of knowing what the difference is if there is not some regulation. So, I am very concerned about making sure that we act. And one of the big problems has been the immunity that these platforms feel because of Section 230 of the Communications Decency Act, which they think says that they're just hosting this vendor and they have no responsibility whatsoever. And I think that is something that we clearly have to change. And we have bipartisan support for that as well. We've seen that the ranking Democrat, Greg Walden, a Republican rather, on the Energy and Commerce Committee, along with the chairman, Frank Pallone of Energy and Commerce, have both sent a letter saying that Section 230 should not be included in foreign trade agreements. And you heard a member of parliament talking about that. He said that he was worried that it would be there, and Speaker Pelosi was worrying about that. They want to extend what they see as immunity all over the world right now. This is the plan of big tech, just like the big pharmaceutical companies wanted to protect themselves in trade agreements all over the world.
Well, now, Congresswoman Szarkowski, though, they will say, and I've heard them say in congressional testimony and elsewhere, yes, there should be some regulation. Yes, we want to be responsible. They will deny what you have just said, that they're just putting out whatever and either don't care about it or aren't interested in doing anything about it.
Well, one of the things that the study by TTP found is that actually Google wasn't even living up to its own community standards. And so then they say, well, but we've hired people, hundreds of people to check to make sure, and these are popping up and they're popping down all the time. And so we are not liable here. We just are hosting. We have nothing to do with this. And so they've been very schizophrenic. Yes, we've heard Facebook in a committee hearing that I had apologize, I don't know, I think about 10 times for things during the years that they have done that have put consumers, or in this case, patients at risk. But now it is time to act definitively, to set the bright lines for them that can't be crossed, to require that the Federal Trade Commission enforce these bright lines and make sure that they are acting appropriately to make sure that people, as you have as you have said, this is now life and death that we're talking about.
Okay, let's travel north a bit to Canada and bring in a member of Parliament, Nate Erskine-Smith. Different laws, different place, perhaps different considerations, but something that you've been very, very outspoken about, but not a different problem. So let us hear your perspective for a few minutes, and then we'll open it up, and I'd like to bring Dr. Stokes and Randy Smith back in as well.
Thanks, Frank. And I think that's right. We face the same problem north and south of the border. And it's just this, as we increasingly live our lives online, we need to ensure that our lives reflect that reality. And we see data and information flow so easily across borders. We need to have international solutions to this. And so that caused our Parliament and colleagues on the Privacy Committee in the last Parliament to work alongside MP Damien Collins in the UK and get this International Grant Committee up and running, which now, for those who want to know more about this, this is over 10 countries and their respective elected bodies that are now working together to identify the problem and to identify solutions and to bring greater accountability to the social media platforms who have failed to take action. Let's be very frank about this, who have failed to take action without that level of accountability from elected representatives.
And you're not saying who have not taken enough action. You're saying have failed to take action.
That's right. I mean, I've been at this for a while now, and we have been calling for action to address the harms associated with social media platforms, whether it is overcollection and misuse of data, and we saw that with the Cambridge Analytica scandal, or whether it is just allowing for harmful content and failing to take action on harmful content. I would say in the course of the COVID crisis, we've seen them take some action, but completely insufficient action. And what do we need in the end? We need, I think, very simply, better privacy and data protection laws. It's crazy that when I purchase a phone, it's defective. I don't need to have read the contract, but if I, as a consumer, if I put an app on this phone, I'm expected to read the terms and conditions to protect myself, and that's an unacceptable state of affairs, and we need stronger laws in regards to privacy and data protection for consumers. But two, in the content conversation, we need social media platforms to take responsibility for the content on their platforms. And I'll tell you, at the International Grant Committee in this past June, so a year ago in Ottawa, Twitter, Facebook, and Google, all on the public record when I put it to them, do you take responsibility for the content on your platform? And each company said yes. And so what follows from that? And we look at advertising. And so in the example we hear from Randy, I think we could have registries of advertising in the Canadian context in the election. We certainly had greater transparency where ads placed on Facebook and on Google didn't participate, but on Facebook and other platforms, they require a registry, so there was greater accountability from journalists and third parties. And in the case of Randy, we would see hopefully disgorgement where Facebook knows the number of people who have been served those ads, the number of people who have clicked through those ads, and they know the profits that they obtained by serving those ads, and they should not be profiting from illegal content and from fraudulent scams. The last thing I'll say on responsibility for content is simply this, that editors have been replaced by algorithms. And this is not a question of Section 230 where they are merely hosts. They are actively promoting content. We had Richard Allen, vice president for Facebook, at a hearing in London, and he said, well, you know, if it's illegal content, we take it down. If it's hate speech, we take it down. But if it's right up against that line, maybe we shouldn't promote it. Of course they should not promote it. Of course they should not profit from harmful content. And we see the consequences in this COVID crisis where failing to take action and failing to take action because of that profit motive ultimately will lead to lives lost.
Dr. Stokes, can I come back to you for a minute, because we're putting this conversation in the context of the COVID crisis. Maybe you can share some of your experience you've had with the anti-vax campaigners. This has been going on for quite some time. This is not new, right? And parallels you see with that?
I think the parallels are unending, but even well before COVID, we've seen how the anti-vaccine movement has had deadly consequences to patients all over the world. Some of my background includes work in global health, that includes the Democratic Republic of Congo. In that country, they have 3 outbreaks going on: Ebola, measles, and COVID-19. And with measles, there's a vaccine for that. And yet here we are, 2020, and we are still battling something as simple as that. And one of the things that has been really disturbing through some of the research I've been doing is looking at how you mistrust, because of not just on Facebook, but also WhatsApp, mistrust towards healthcare providers actually becomes another new barrier for people already vulnerable and lacking access to care. And those barriers end up sometimes turning deadly, not just to those patients, but to those providers. People may not know this, but pretty much since the start of the 10th and most recent outbreak of Ebola in the Democratic Republic of Congo, there have been over 400 attacks on Ebola treatment centers, specifically targeting providers. And these attacks are intrinsically linked to the misinformation that's going on Facebook and WhatsApp that says these providers are trying to give Ebola to their women and children, that say that the vaccines that we're trying to give are actually poisonous. And again, you don't have to have theoretical conversations about this. You can measure this in how many lives we're losing.
So it's a great place to come back to Senator Blumenthal and Congresswoman Szarkowski. Let's make the distinction between scammers, okay? I'm going to sell the pill, you can get healthy, it'll be fine, and conspiracy theories that drive distrust, that may prompt attacks like this. So, Senator, let's start with you. How do the media platforms themselves distinguish between these two and are held to different accounts? These are different things, right? I mean, it all falls under the kind of the big umbrella of disinformation. This is bad information that's going out there. But a driving conspiracy theory that is meant to confuse, that is meant to sow suspicion, that may be meant to prompt violence, God forbid, or attacks, is a different place, it seems. And actually, if we think about the vaccine that we hope is coming down the line for COVID-19, this is going to be a huge problem when this comes around.
It's a huge problem right now because of the fake cures, and you may distinguish them from the conspiracy theories. But the simple answer to your question is that the platforms fail to oversee or scrutinize any of them effectively. They have very weak methods of review, some of them automated, but, and here's the really important point, right? They say to the public, we review them, we do our due diligence, we oversee them for truth. In effect, you can depend on us. So whether it's conspiracy theories or false cures, they have terms of service that falsely tell people that they're overseeing or scrutinizing the ads and pitches and promotions that appear on their platform. That is why the FTC can and must take action. It's what I would call a garden variety false claim, misleading and deceptive practice. And whether it is conspiracy theories or false cures, the heartbreaking, horrendous results have real life effects on people across the country, around the globe. And here is the dirty little secret about it, Frank, and you know it. They have these really powerful machines that can target individuals. It's not like a billboard on the highway. Whoever passes sees it. They can target individuals through search words and other automated procedures, and they're selling this hugely beneficial, but also possibly destructive capacity to the highest bidder. It is, in effect, they're selling this capacity to do sometimes great good, but in these cases, great evil.
Well, as anybody has ever seen who's gone shopping for tires, and suddenly tires start showing up, tire ads start showing up all over. I mean, we're micro-targeted with virtually every interaction we have. We have another piece of the video that we started earlier that kind of illustrates this conspiracy theory. It focuses on the 5G components story that you know about. Let's just roll that quickly and come back and pick this up. And Congressman Szarkowski, I'll start with you when we come out of the video.
There's a conspiracy theory sweeping the globe that coronavirus is caused by 5G technology.
Some people in the UK bought into it so much they started lighting cell phone towers on fire.
There's your 5G policy. 5G mast on fire.
The person in the vehicle next to me was screaming, shouting that 5G is killing us all. I don't have any morals. Do I have children? They're going to be ashamed of me and I'm going to kill everyone. And the next thing, the the guy in the car next to me gets out of his vehicle, actually tries to open my passenger side door, tries to get into my van, making some quite absurd threats. If he did get in the van, there was a clear physical violence threat that he was making, and he seemed quite keen on carrying that out. It's crazy because I've seen so much on social media. It's free to post whatever you like, and that can be quite dangerous.
A lot that's quite dangerous here, it seems. Congresswoman, your reaction to that and to these conspiracy theories that go way beyond sowing doubt, they really threaten life.
Yeah, as you say, you can see how it can promote violence. It can promote uprisings. It can absolutely be, these platforms can be deadly. One of the apologies that Facebook made was help allowing the promotion of the genocide that took place in Myanmar before they finally did shut down the websites that were doing that. So, you know, we have to understand that as much as how our lives have been changed for the better, there is so much danger out there. But we also have to acknowledge that there are the tools, that we are not powerless when it comes to doing, and the platforms themselves say that they have community standards. They say that they follow them. And so if they are forced to follow their community standards, and if the enforcement agencies would get to work, if we would if we would reform 230, the law that they say that gives them immunity. You know, when Facebook's representative came and spoke before our committee, talking about community standards, and let's remember they have over 2 billion individuals that participate in Facebook. It's bigger than any country in the world, all cross border, cross language. Mark Zuckerberg was in California while she was in Washington saying, no, advertising, we're allowed to advertise anything. That is not our responsibility. And we're going to double down even on political advertising, that it doesn't have to be truthful. And so, you know, we have a lot to worry about, especially, and we talked earlier in the panels, you talked about the elections coming up. We want to make sure that there is truth online.
Nate Erskine-Smith, from the Canadian perspective and looking at these conspiracy theories that are out there, what do your best practices, what do your laws suggest should be done to hold these platforms accountable?
So in the last Parliament, we looked at algorithmic accountability because we know that these platforms are not creating the content, but they are promoting it. And the examples would be YouTube's recommendation function or Facebook's newsfeed as two very large examples. And they're a bit of a black box. We see rules around the world on algorithmic explainability. I would say it doesn't go far enough. And an example in the Canadian context, if any federal agency now wants to undertake using an algorithm that might have some harmful or negative impacts, they have to answer a series of questions. They have to explain what that algorithm is going to do, the inputs and the outputs. And depending upon the risk profile, then a number of actions are required to address the potential harms. And I would say when you have such large scale information that is being amplified by these platforms that in some cases can cause great harm, the platforms need to take responsibility and they need to be held accountable for when they are profiting from content that they promote. We know there are broadcasting standards councils in all of our countries. And I've heard very intelligent ideas from academics in Canada to call for social media standards councils. I mean, there are lots of ideas out there that would move the needle significantly to improve the online environment for all of us.
Senator Blumenthal, could we have a social media standards council in this country, given who and what we are? Oh, you're muted. Sorry, just There we go. Oh, no. There you go.
Thank you. I think we could well have.
Who would be on that council? What would they be sitting in judgment on?
Well, here is a potential model. It is actually included in a legislative proposal that I've made. It's bipartisan. Senator Graham, the chairman of the Judiciary Committee.
That would be Lindsey.
And he is a Republican from South Carolina.
Last we checked.
He and I have proposed a measure called the Earn It Act that essentially would attack the problem of human trafficking that is done on these platforms. And of course, Section 230 is a barrier to effective action against the platforms as opposed to the traffickers. So what we've said is we'll establish a panel with representation from all of the potentially interested parties, including the tech companies, and say to those tech companies, you have to comply with certain standards, certain terms of service, but they are essentially guidelines and standards as to what is acceptable behavior. And then you can earn your Section 230 protection. Now, this proposal is a very narrow and carefully considered targeted measure that deals with the Section 230 immunity issue that Congresswoman Szarkowski mentioned earlier. Remember, Section 230 dates from a time when the internet was nascent, when these tech companies were just beginning, and the fear was they would be subject to all kinds of frivolous, harassing, burdensome lawsuits. They're now mammoths, and they are more powerful than many small countries. So that kind of standards panel may be difficult to implement with respect to community ad, with respect to political ads, but it is possible. What I think is even more feasible is for the platforms to take real responsibility. You know, when I began on this effort against pornography on the platform, they all said, you know, we really can't do any of the screening. We don't have the technology. This pre-algorithm, we can't have people search every one of these ads. And lo and behold, when they were given an incentive to do it, namely potential lawsuits, which as Attorney General, I said we were going to do, they began to, lo and behold, discover ways to police themselves. And I think the same kind of self-policing, internal responsibility is part of the solution here. They claim they do it, they don't really. You mentioned earlier how best to require them. And I think that legislation ultimately may be the answer, whether it is the Earn It Act or others like it that target these kinds of disinformation, deceptive and misleading practices.
I'd like to bring in Randy Smith and Dr. Stokes again and give you an opportunity to speak to these three very distinguished lawmakers. Randy, let's start with you. I mean, you experienced this incredible scam problem that we've now learned about, that you've explained to us. You deal with at risk youth. You are trying to do great things in the world. You see your continuing experience online and with platforms. You see these young people who you are trying to guide and shape and help. What would you say to these lawmakers, Senator Blumenthal, Congresswoman Szarkowski, and yes, a member of Parliament from Canada, about, from your perspective, really dealing in the very front lines of this, what you need from the platforms and from them?
Well, thank you. A couple things stood out that I heard. Certainly, Senator Blumenthal's great comment about targeted advertising versus driving by and seeing a billboard. And the biggest problem I see is what they're doing, these platforms are doing, is they're doing redirect. So they're not only redirecting consumers from true solutions, but they're bringing them to now false and incorrect solutions that don't solve anything. That certainly affects a large segment of the population and certainly those we serve, because many of them are lower income. When they make a buying decision, they rely on the fact that it's going to happen, and it could be masks, it could be anything. So I think that we have to. I would ask that we look at this as not just a standalone case or cases, but the fact that it's redirecting from real solutions. Nate Smith had brought up the fact check and the point of being truthful. The fact is, Facebook has a means for fact checking. I think it might go through their Instagram side, but you could post something and within an hour, it's down as fact check not correct. So my question is, why are these scams allowed to still go on? And it almost becomes, in my mind, willful. And so my request would be that, yes, I think there needs to be legislation. I think that there needs to be fines levied. I think that people need to be held accountable, and to protect all consumers. But on our end, especially consumers who are maybe not as savvy on business, internet purchasing, and have very limited dollars.
All right, well, let me move that around because we're almost out of time here. So Congresswoman Szarkowski, you want to go first on that?
Well, I just want to say that Senator Blumenthal correctly said that these platforms are complicit. Well, we as Congress don't want to be complicit by not doing what we need to do. And I hear you, Randy. I think there are things that we are required at this point to do to protect consumers. And I'm so proud to work with Senator Blumenthal to make sure that these things are happening.
And MP Erskine Smith, your response to Randy?
So I think we need to continue we need to, one, support the social media companies when they do take positive action. And so to Randy's point, where there are practices within our portfolio brands like Instagram that are taking better practices, we need to hold those out as examples and to encourage these companies to elevate them. But in the end, we know time and time again that self-regulation has been insufficient. And so it's not enough for Facebook to come time and time again to committees like ours and say, we're sorry for the harms wrought by our platform on society. We need regulations, and we need all governments, all parliaments, Congress working with the Canadian Parliament, working with the UK Parliament and beyond, to put rules in place, because this isn't a problem for the United States. This isn't a problem for Canada. This is a problem for our world.
That is so important. It's so important, but it makes it so much more complicated, right? To understand that these companies are global companies. The borders don't matter, right? You're a Facebook and you have a Facebook friend wherever, whenever, all in real time. And so, but having a patchwork of regulations and laws and accountability measures isn't enough. Dr. Stokes, I want to come to you for sort of some of the summational comments here, because your discussion today has been so unbelievable. You're working with patients up close. You're working with communities who are at risk. You brought a global perspective to the problems of the conspiracy theories and the scammers out there. What would you say to these legislators that, as a doctor looking at the physical health and the public health, we need the most?
Well, as a doctor, I hope that makes it clear that I don't for one moment say that I'm an expert on the solutions. I'm just presenting a problem. And I want to make it clear that my testimony is not meant to vilify social media companies. In the middle of a pandemic, everyone is scared, people are dying, and we're all looking for someone to blame. I think that as much as possible, to have a collaborative effort is always preferable than a confrontational one. And one of the things mentioned by Senator Blumenthal gives me hope. A Social Media Standards Council, though I myself do not know what the details of that would be, but if that would involve somehow bringing everyone to the table to set rules of the road, I think that I know there are people in some of the companies that I mentioned, Facebook. There are people with good intentions who want to do good, but those good intentions are just not good enough. And If we can figure out a way to harness their power, bring people together to come up with the solutions, I think it's possible, but we have that pressure of time and people's health and their lives.
Senator Blumenthal, let you take the concluding comment.
I'm always in favor. I hope I'm unmuted this time.
You are.
I'm always in favor of a collaborative effort. Of course, my career in law enforcement leads me to think that sometimes, although honey can work better than vinegar in some instances, sometimes law enforcement is necessary as a deterrent to misconduct. And I will say, and you mentioned it earlier, that you've heard countless times big tech say, oh, we're going to do it differently. This time will be different. We heard that at the beginning of the COVID-19 pandemic. And the stark, staggering truth, you heard it from Frank Smith, you've heard it from Dr. Stokes, is these kinds of scams and frauds and con artists are appearing regularly without any real action on the part of the platforms. And that's why we need effective enforcement by the Federal Trade Commission, more than just rhetoric or words, but real action. And Congresswoman Szarkowski is absolutely right that Congress needs to act as well, whether it's a community standards panel or more likely targeted reforms to Section 230, or as Speaker Pelosi, I think, mentioned earlier, maybe other incentives like taking down advertising. If that kind of effort can be organized effectively, maybe it can provide incentives for these platforms. But why do they not act more responsibly? Again, I don't mean to be overly cynical, but their business model is the clicks. Their business model is targeted advertising that generates those clicks. And that business model that is generating billions and billions of dollars for this industry, sometimes it's better served by their opening the gates without being too discriminating as to who comes through them.
And before we go, and I guess I would ask this of all three of the legislators here very quickly, do you feel that something is changing though, and maybe driven by COVID-19 and the disturbances we're seeing and everything else, that the broad public is realizing that this disinformation is not just out of control, but a fundamental threat to our physical health and to our national health. And maybe it won't happen before the election, but that there is a critical mass that is shifting around this issue, and maybe we're going to get serious. Or am I being Pollyannish here and just kind of chirping into the wind? Because
if I could, this is Jan Szarkowski. I think this is a transformational moment, and I'm very optimistic about change. And the reason is that it looks like ordinary people have really found their voice, a kind of insistence that I hear that they want to be treated fairly. And I think that transfers into all different arenas. So I actually do feel optimistic at this time that we can do what we need to do on this disinformation and also the racial justice front and all of the problems that we're facing right now with the coronavirus. Yes, I do think we can.
Nate?
I think it's a question of whether Congress is ahead or behind the American people. If Congress yields to the special interests, to the immense political and financial power of the platforms, big tech, progress will be exceedingly difficult. On gun violence prevention, the American people overwhelmingly, 95%, favor background checks. But the NRA and the gun manufacturers have managed, through their grip on the Congress, to prevent it from happening. The question really is, and I think Congresswoman Szarkowski is absolutely right, we're at a transformational moment on racial justice, on economic justice, on hopefully the pandemic in terms of healthcare. But Congress has to be at least on a par with the American people, not behind it, not in the grip of these special interests.
Nate,
we need to fight for.
Nate Erskine-Smith.
I think you're right that there is a growing consensus and support for the idea of emphasizing the science and not sensationalism when it comes to saving lives, especially in the course of this pandemic. But let me just say, as a Canadian, and I have loved ones, I've got family and friends who are Americans, but the challenge and the elephant in the room that has not been discussed on this panel is that the misinformation related to COVID has not only been the fringes of the internet, but has also come from the largest megaphone in North America, if not the world, which is the office of the President of the United States. And that's a challenge that can't be solved by the discussion we're having today. It's got to be solved at the ballot box.
Well, I want to thank you all very much. Senator Blumenthal, Congresswoman Szarkowski, MP Nate Erskine-Smith, you're all phenomenally busy, especially in the midst of all of this. Thank you so much for spending some of your valuable time, so much of it, on such an important topic. To Dr. Stokes, your work with human beings who are sick or who fear getting sick, and you're up against so much, and you've gone through so much yourself. Just a special thank you for everything that you've done, and our very best for you to stay healthy and strong and continue doing this great work. Your contributions to this conversation have added so much, and I hope our members of Senate and Congress will keep them close to them as they go about their business. Randy Smith, the work you do with at-risk youth and the experience that you've had, again, I'm glad that the Institute of Data, Democracy, and Politics and the work with BuzzFeed was able to expose some of that to a very, very large audience. Thank you for spending time here today. Hope that doesn't happen again. and you're very articulate and you're very compelling in all of this. So thank you as well. It has been a very, very full hour. So just a couple of final thoughts. Here's what we know and what we've heard. We're suffering through a global pandemic, experiencing some of the worst economics, well, no, not some, the worst economic crisis since the Great Depression, measured in a number of ways. That's a global thing. We're also witnessing a push for change in our streets and our communities, driven by years of disparities and injustice that the COVID-19 pandemic has made worse and made clear. We're watching trillion-dollar companies that, as we've heard, too often put profit over human toll and turn a blind eye or do too little to confront the disinformation crisis. So we've heard so clearly, in the words of the doctors who have joined us here, disinformation can kill. That social media platforms must recognize their responsibilities to their citizens, to society, to their consumers. They must step up and put their wealth and their resources and all that brilliance that's made them what they are today, part of the solution to stop the scourge of disinformation that distracts, that divides, that confuses us and costs lives along the way. The participants in this forum that we've had are demanding accountability from the social media platforms. They're working to force change, and regardless of your politics, to protect citizens, consumers, and our kids. So we're very grateful for the speaker's time at the outset of our earlier panel, for the admonitions of Vice President Jourova from the European Commission in our earlier panel, for the contributions of all of our panelists and witnesses, especially grateful for that powerful testimony from those who are working with this problem and trying to keep their equilibrium. There's a lot to do. The forum has highlighted the important work of the International Grand Committee on Disinformation, the need of legislators around the world to cooperate and collaborate to address this threat, international legislative and regulatory staff tackling these issues, and some starting to convene tomorrow. We'll be very closely following this process. I also want to tell you again that this is one in a series of panels that we'll be hosting. I hope you'll join us again on June 29th for our forum on the really timely topics of election interference, racialized hate, and voter suppression. On behalf of the George Washington Institute for Data, Democracy, and Politics at the School of Media and Public Affairs, whose mission is to help the public and journalists and policymakers better understand and develop sound solutions to disinformation and other online harms, I'd like to thank you very much for joining us. I'd also like to issue a very special thanks to my colleague, Steve Livingston, who is the director of the Institute of Data and Democracy and Politics. Will be the founding director in his new role. It was his vision, it was his energy, it was his drive that helped to put together a proposal and to help us articulate a role for IDDP in convening conversations, vital conversations like this, in doing the research to find Randy Smith's story and to see where these disinformation campaigns are coming from. We are all in this. We are all committed. Steve Livingston, thank you so much for what you have enabled. Look at this conversation we've had here today.